All right. Well, good morning, everyone. Thank you so much for joining us today. My name is Katie Baker, and I am the Virginia State Director of Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through events like this one, where we raise public awareness about the most pressing healthcare fights of our time. I want to thank Congressman Beyer, Senator Favola, Chair Ferranti for joining us today, as well as my colleague Ann Schelp from our national team at Protect Our Care, who's also a Virginian and a constituent of Congressman Beyer, as well as our partners, my union siblings at SEIU Virginia State Council, for graciously partnering with us to co-host this event as we launch our Sick of It campaign here in Virginia. Sick of It is a national months-long effort in which we will be continuing to raise public awareness about the devastating impacts of the healthcare cuts made a year ago in what we just call the big ugly law. And our message is very simple: we're sick of it. We're sick of Republicans cutting healthcare in order to fund tax giveaways for the ultra wealthy, and we're going to be continuing to sound the alarm with storytellers, elected leaders, advocates through the coming months. And with that, I'm very excited to introduce my friend, my union brother, my very often partner. I was going to say partner in crime, but I'll say partner in good trouble in many ventures, and that's David Broder, who is the Executive Director of SEIU Virginia State Council. David.
Thank you so much, Katie, and everyone. Thank you for inviting the SEIU Virginia State Council to join you today as we announce our members' strong support for Protect Our Care's Sick of It campaign, because truly, working people are sick of it. We are sick of having the world's first trillionaire while millions go hungry. We are sick of corporations paying less in taxes than the workers who power them. And we are sick, absolutely sick, of a healthcare system where frontline home care workers like Renee provide life-saving care to others and yet are forced to go without health care for themselves and their families. SEIU members, and it's wonderful to be with them here today, have long been at the forefront of a movement for quality, affordable health care for all people. SEIU workers helped establish the Affordable Care Act. We partnered with so many to win Medicaid expansion here in Virginia, and we fought tirelessly to oppose Donald Trump's big ugly law, which prioritized tax breaks for his ultra wealthy donors over the life and death needs of working families. We know what's at stake here today, both for uninsured workers like Renee and also for the older adults, the people with disabilities, and the families who rely on home care, because home care workers make all other work possible. Home care workers, like so many workers in our economy, power Virginia. They ensure that our loved ones get the care they need to live with dignity and respect in our homes and communities. And let's be real, Virginia already faces a care crisis with a shortage of home care workers due to the low pay and lack of benefits. Affordable Care Act tax credits were the only thing that was ensuring that many care workers had health insurance at all. And now MAGA Republicans rip those tax credits away, shred our care, and threaten the well-being of care workers and families throughout our community. It's why these cuts to frontline workers' healthcare are so devastating for our entire economy, and why we are truly, truly sick of it. And yet, while we are disgusted by those who would prioritize trillionaires over working families, we are undeterred. And so today I am proud to join my union family and powerful state and local elected leaders alongside one of our strongest allies in Congress, Congressman Don Beyer, in the fight to hold MAGA Republicans accountable for creating this healthcare disaster that we all face. Today and in the days to come, union members will share our personal healthcare stories. We will educate our friends and neighbors. We will help drive a people-powered movement that will protect and expand high-quality, affordable healthcare. And that starts by restoring every single dollar that was cut last year, and it starts with holding every single elected who voted for those cuts accountable. Now with that, I am honored to welcome a fighter, a friend, and a true champion for working people, our Congressman, Don Beyer.
David, thank you very, very much. And I want to thank you to Protect Our Care and SEIU excuse me, for putting today's important conversation together as we launch Sick of It campaign. This campaign could not be more timely. For the past 2 months, House Republicans have been trying and failing to pass a resolution celebrating the first anniversary of the big ugly bill. They call it the Tax Cuts for Working Families. We call it the Tax Cuts for Non-Working Families Act. They're set on getting members of Congress on the record about their record-setting cuts to Medicaid, the Affordable Care Act, and other essential programs. I'm happy to let them. They can remind people that they passed a bill that strips health care from millions of Americans and raises costs for millions more. All because they decided it was better to fund tax giveaways for billionaires. To date, the big ugly bill has cost 100,000 Virginians health care coverage in the ACA marketplace and threatens coverage for 550,000 more people enrolled in Virginia's Medicaid program. Think of that, that's almost a tenth of Virginia's population. Many of these people are among the sickest, poorest, and most vulnerable people in our communities. And there are those of us in the room who've been impacted by this, either directly or by having someone of their loved ones lose their insurance because they can no longer afford it. We're going to hear from Ms. Renee today, who is now going without insurance since those tax credits were taken away. Deliberately not denying people like Ms. Renee coverage is unconscionable. And the impacts of the Republicans' big ugly bill go beyond those direct cuts to health care coverage. People don't stop getting sick because they don't have insurance. They also don't stop going to the hospital and receiving care while they're there. So hospitals across Virginia are seeing sicker patients, and they're all coming to see us on the Hill to complain that they don't know whether they can stay open. The vast majority of them, by the way, come in through the emergency departments. In fact, 90% of the people in hospital beds have come through the emergency department. And the hospitals have to fulfill their responsibility to provide those patients care. But not every hospital, in fact, most hospitals cannot absorb that additional cost. Just last month, Virginia's Joint Commission on Healthcare found that 13 rural hospitals in Virginia are at immediate risk of closing. And that's more than 1 in 3 rural hospitals in America. For 3 weeks, I had the opportunity to represent a different district that included the Middle Peninsula of Virginia and Virginia's northern neck and the like. The number one thing that everyone told me while I was down there was the concern about the rural health care and the hospitals. The whole notion that it took 45 minutes to get service for a heart attack and 2 hours to go to have a baby. Virginia was already one of the first states in the nation to have rural healthcare centers shut down, 3 last year. And they directly cited the big ugly bill's healthcare cuts as the reason. We can't sugarcoat this. People are going to die because of the Republicans' big ugly bill. And my highest priority is reversing these disastrous cuts, not celebrating them. We've already talked about if Democrats are fortunate enough to retake the House in 16 weeks, our first bill will be restoring the cuts to health care. That's why I'm proud to join the Sick of It campaign. And I call on my Republican colleagues in Congress to prioritize health care affordability, not tax giveaways for the ultra wealthy. And I look forward to continuing to work with Protect Our Care, the wonderful, hardworking partners and friends at SEIU, and everyone who knows that we need to make health care more affordable. The Declaration of Independence talked about life, liberty, and the pursuit of happiness. it's very hard to pursue happiness when you're sick. And all of us get sick, all of us need the health care that allows us to fulfill the promise of America. And I'm thankful for everyone that's part of that fight. With that, let me pass it back to Katie.
Thank you so much, Congressman. Thank you for being such a champion. You've done a lot of these events with us to sound the alarm about the threats of these healthcare cuts. And I do remember those 3 weeks in which Tappahannock would have been in your district, because that hospital in Tappahannock is one that was named as at risk of closure. And we did an event down there to sound the alarm on that as well. And really just want to commend Senator Barbara Favola, who's the chairwoman of the Senate Education and Health Committee, who also the chair of the Joint Commission on Healthcare, who produced that report showing us the real risk to our hospitals. And she's also leading the charge to do what the state can at the state level to try to mitigate some of the damage from the loss of those enhanced premium tax credits. But of course, it is more limited what a state can do compared to a federal government. So I will let her speak more to that. Chairwoman.
Thank you, Katie. First, I applaud Katie, protect our healthcare, and also my friends from SEIU. This topic is incredibly, incredibly important, not just to Virginians, but to all Americans. We just went through, many of you might remember, a very rigorous budget cycle. The General Assembly passed a budget in late June, and the governor made some tweaks, and the budget was signed. But as part of that budget process, we heard incredibly compelling personal stories from Virginians who were working, attempting to support their families, trying to make a life for themselves, searching for a more affordable life because rents were going up and SNAP has been considerably reduced, and then they were hit with healthcare issues. You can't control when you're sick or when you might need to go to a doctor, and to not have the ability to go when you are actually sick is actually incredibly hurtful and harmful, and in some cases could be life-threatening. We as a country have got to re-examine these priorities. Why President Trump and all of the Republicans in Congress went along with a decision to remove health care, life-saving health care, a decision that has an impact on our rural hospitals, a decision that is going to cause our insurance premiums to increase for everybody, and a decision that could not be more devastating. Why they went along with that, to give tax cuts to billionaires, needs to be questioned, needs to be spoken to. And the lawmakers who made that decision need to be held accountable. This is not the way you're going to grow your country, you're going to grow your economy, you're going to support your future, you're going to help the residents here that we all need to support and help to make a good living. So it was very devastating. Some of the things probably you're not completely aware of in the HR 1, immigrants who are here legally, HR 1 removed coverage. HR 1 has prohibited any Medicaid dollars going to Planned Parenthood clinics, and 97% of their services are preventive. 97%. They're providing these life-saving screenings, cancer screenings, and a number of other preventive services. The HR 1 also prohibited states from continuing to tax hospitals. I'll change the word prohibited. They are requiring states to reduce the taxes that we were placing on hospitals to help us pay for our share of Medicaid expansion. Yet another hit on the budget. So when you look at all of these cuts taken together, the safety net is pretty loose. There are a lot of holes in it. We did what we could at the state level to fill some of those holes. We do have an emergency Medicaid fund set aside to help a little bit buffer some of the cuts, but we will not be able to buffer all of them. When the federal tax cuts ceased, 100,000 Virginians dropped their health insurance immediately. And we're expecting, up to 400,000 Virginians between the cuts of not having tax credits extended and the Medicaid expansion cuts. We're going to have at least 400,000 Virginians right away without insurance. And we do have 13 of our rural hospitals at an immediate risk of closure or reducing their services substantially, not having labor and delivery services, not having acute care beds. So where does somebody go if you happen to live in the rural parts of our state? Whether you have insurance or not, you'll be traveling an hour or an hour and a half to get coverage, any kind of access. If you're looking at the need, if you're having a heart attack and you need to go to a hospital for acute care. So this is the reality, and it is an incredibly hurtful reality, and we have to stand up and say, access to health care cannot be a privilege. Individuals cannot pursue life, liberty, or happiness if they cannot have health. Thank you.
Thank you so much, Senator. Thank you so much for your leadership at the state level in the midst of this healthcare crisis. And thank you for reminding me and reminding the room here that the Big Ugly Law also did defund Planned Parenthood. Planned Parenthood Advocates of Virginia and Jamie Lockhart, their executive director, have been tremendous partners to us. They've traveled throughout the state with us, sounding the alarm. Jamie wanted to be here today and sent her regrets. I know the National Planned Parenthood folks were at our national launch yesterday, so really just appreciative of everything they're doing. And I know Planned Parenthood's seeing their cancer screenings reduced over the last year. So that's really disturbing to think about. When the congressman said people will die from this law, that is absolutely true and very sad. And with that, I want to turn it over to the chairman of the Arlington County Board of Supervisors, Matt D. Ferranti, who we're really appreciative of his perspective as a local leader and what these cuts mean to his community. Chairman.
Hi, everyone. Thank you very much, Katie and Congressman Beyer and Senator Favola. I'm proud to join the Sick of It campaign because local leaders, this local leader and our local leaders in Arlington and across the state are truly sick of the healthcare mess created by Donald Trump and the Republicans in Congress. All levels of government, local as well as state and federal, are feeling the impacts. I get to see our neighbors and friends in grocery stores asking, what can you do to help? And there are tools that local governments can use, and we are using them. But since the passage of the Big Ugly, and I would add inhumane and terrible law a year ago, this month, we're seeing our safety net strained like never before. Just this morning I was looking, our statistics show an increase of thousands in the number of individuals who are struggling economically at 30% of the area median income. 26,000 members of our community rely on Medicaid to access affordable health care. We have a prosperous community, but 26,000 people are depending on Medicare. The restrictions and the cost-raising measures, they're aimed, as Senator Favola mentioned, at kicking people off of Medicaid, all for the very wealthy. That leaves state and local governments in a very difficult spot. In our last budget, I added funding for some of our healthcare providers for those most in need and health equity language to make sure that we, on an ongoing basis, step up. But what Republican leaders clearly don't think about is that local leaders are stepping up, but it has to be a partnership with the federal government in addition. And we have to do more to address. In Arlington, we faced DOGE cuts that impacted the economic security of our federal workforce, but that has a ripple effect on those most in need. We had additional, some of the investment that I mentioned was the Arlington Free Clinic, which I think colleagues, Senator Favola knows dearly, and so does Congressman Beyer. We added opportunities grants funding, which was very important to me personally. We're spending money to fix a problem that should never have come to us at a time when we absolutely didn't need it. We're playing catch up on this problem we didn't have anything to do with creating. So thanks again to Congressman Beyer, Senator Favola for trying to mitigate some of those challenges. But we have to protect our care for our neighbors, the ones I see in the grocery store, the ones who are on text chains with my friend Janeth and others. To protect our care, thank you so much to SEIU and to Ms. Renee, who will speak in a minute. Thank you for speaking your truth. The Arlington County Board will do everything we can, but we have to hold accountable leaders who aren't standing with those most in need and aren't protecting the health care, the life-saving health care of our neighbors and friends and families. Thanks so much. Back to you, Kate.
Thank you so much, Chairman, and I know a number of our speakers spoke to that 100,000 number. You know, I remember sitting in a committee room in the General Assembly building in Richmond last summer, I think it was around August, and the Virginia Health Benefit Exchange folks were giving a presentation, and they said, if these tax credits are not renewed, these enhanced premium tax credits that are making healthcare more affordable to the Virginians who buy their health insurance through the marketplace. So that's a lot of self-employed folks. They're people who make too much money to qualify for Medicaid, but for whatever reason, they're not getting affordable health insurance through their workplace. They told us 100,000 people are gonna drop out of this marketplace. And lo and behold, just this month, they put out a press release announcing 100,000 people have dropped their health insurance plans or been kicked off for non-payment because they can't keep up with that payment. And very sad to share that my friend and SEIU Virginia 512 member, Miss Renee Bumbrae-Graves, is one of those 100,000 people who has had to forgo her health insurance due to the loss of those enhanced premium tax credits. She's been sharing her story all over the state and even testified before the House Budget Committee so that they could hear her story. And I'm honored you're willing to share it again with us today. Miss Renee.
Thank you. Good morning, everyone. Thank you so much for having me here today. My name is Joyce Renee Bumbrae-Graves. I am 63 years old and I live in Woodbridge, Virginia. I am a home care worker and a proud member of SEIU Virginia 512. And let me just start out by saying that care is essential because everyone will need it at some point in their lives. I am honored to carry on the legacy of Black women and other women of color, like myself, who have historically done the majority of care work in our country. I provide care for my adopted sister Leah, who has spina bifida and scoliosis, and my great niece Lisa, who has scoliosis and was born with a small brain and is profound. That means she cannot speak or feed herself, and she's completely dependent on others for basic life functions, 24/7. Both ladies use wheelchairs. They came to live in my home in 2007 when my parents passed away because I wanted to, excuse me, I'm so sorry. Take it out, if I turned it off, but I don't know where it's ringing. Sorry about that. Do you need me to start over? Or?
No, you're on.
Okay, I'm so sorry. Okay, so they both ladies use wheelchairs. They came to live in my home in 2017 when my parents passed away because I wanted to keep them with family. I had already been working with Leah for over 10 years. Both ladies have Medicare and Medicaid due to their disabilities, but they have lost a lot of benefits with the Medicaid. They have reduced, them getting food stamps and things like that. I work in healthcare and I can't afford healthcare insurance. My husband is a freight driver and it would be very expensive for me to get insurance through his job. It would be over $1,800. Instead, we both got our health insurance through the Affordable Care Act. We were paying $544 per month for the premiums last year, thanks to the Affordable Care Act tax credits. Now that these tax credits have been taken away, the premium went up to over $1,300. And we kept checking, and every time we checked, it was just rising more and more, unbelievably. So we cannot afford to get that plan again. So my husband's job, fortunately, has insurance for him that is a little bit over 100. So he has some health issues. So I told him to go ahead and take that. But it was just too expensive for his job as well to take me on, because it was, oh my God, closer to $2,000 a month. And we definitely could not afford that. So at this time, I'm uninsured. It has been hard. I've had several medical issues. I've had 3 pulmonary embolisms from blood clots. I have stopped my prescriptions for a dry powder inhaler, which helps me to breathe better, because I cannot afford it without insurance. It's over $300 a month. I need injections to help manage my back pain, but I'm not able to get them as often as I need, because they're over between $700 and $900 a month. But thankfully, my doctor's office is letting me pay on one, because he sees that I am in a lot of pain with my back, and I don't want to not be able to keep working. And in the meantime, our other bills don't go away. Both of our cars just went out within 2 weeks of each other. And we needed to get a vehicle for home, which wiped out our savings. And then my husband's car 2 weeks later went down. We had to pay another $1,000 and something. Within 2 weeks, we had to wipe out our savings and for both of the cars. So right now, we don't have any extra for anything to do and stuff. And now something's going on with our hot water heater. But I'm afraid to even call the plumber, because I don't know how much it's going to cost to just have them come out. So we've been dealing with that issue this week. And I want to say, healthcare is definitely essential for everyone. So I'm here to say that I'm sick of it. I work so hard to keep people with disabilities alive, and I can't afford insurance to ensure that I can stay healthy and capable to continue to take care of them. And I'm thankful to Congressman Beyer for being here with us. I do not understand the Republicans in Congress. I just feel that they can all vote yay or nay, and whatever, that they'll be fine. But what about us? I wish they could see me and so many more people like me who are without health insurance. They need to bring those tax credits back so that I can get my health care back. I need to get back on the Affordable Care Act, because it'll be 2 more years before I'll be able to qualify for Medicare. So I'm proud to stand with you all today as we demand that Congress reverse these cuts. Thank you all for seeing me and hearing me.
Thank you so much, Ms. Renee, for sharing your story. I'm so moved every single time I hear it, and I just think that there are 100,000 stories in Virginia alone, just like yours, of people who have either just made the decision, I can't afford this, or who re-enrolled and tried to keep up and just couldn't make the payments because they went up so much, as you shared. And as our speaker spoke to, it's not just the Affordable Care Act and folks who are getting their insurance that way. Next year, those Medicaid restrictions are going to go into effect. And they were designed, as I know one of our speakers said, they were designed to kick people off. And I think about people like my friend who cleans houses and is trying to start a business, and she doesn't always get 80 hours a month worth of work, which is what is the requirement to keep Medicaid, because people cancel, people go on vacation. I had another woman who wanted to speak today, but actually was very happy she just got a new job after 2.5 years of looking. But she had been on Medicaid for 2.5 years after being laid off. And I think a lot of folks know that the white collar job market right now is really tough, especially in Virginia, where you've had all these DOGE cuts. And in addition, she's over 50. She believes she was facing age discrimination as well. So she's wondering, well, how long is Medicaid going to keep me on if I'm not working for 2.5 years because I can't find a job? And then, as Senator Favola spoke to, even people who are not on the Affordable Care Act or who are not on Medicaid are going to be at risk if you need to get to a hospital nearby you, particularly if you're in a rural area that has cut services because, or has closed down entirely because that hospital is relying so much on the revenue from Medicaid, and they cannot sustain the cost of all that uncompensated care when people start showing up, because the emergency room is the only place that will take them when they don't have health insurance. But I will just end on, I wouldn't say a positive, but a resolute note, in that we are just going to keep banging this drum, going all throughout the Commonwealth to make sure we're spreading the word about what the harm of these cuts are, that we're elevating the voices of people like Ms. Renee, so that these elected leaders and every single Republican in Virginia's congressional delegation voted for the big ugly law. So they are all responsible for this, so that hopefully they will finally hear them, and we can get that bill passed that Congressman Beyer spoke to as the first order of business, and reverse every dollar of these cuts. So with that, I want to thank Congressman Beyer, Senator Favola, Chair Ferranti, David Broder at SEIU, and of course Ms. Renee, and everyone for joining us today. And just open it up. Michael, did you have any questions? Not to put you on the spot.
That's okay. So Sick of It, this is the campaign your organization is doing. Aside from raising awareness, what is it specifically that you're looking to do as we get up towards the election?
Look, we are not engaging in electoral advocacy. We are raising awareness, and we want to hold Republicans accountable for these votes. We want to make sure that people understand the impacts of them, and we want people blowing up the phones of these members of Congress who voted against these cuts, so that we can change hearts and change minds. And I'll also share with you, I believe you're on my press list, but we did put out some polling recently from Navigator, just showing that these cuts across battleground districts all across the country are incredibly unpopular. Yeah, and if you want to do one-on-ones with anybody, we could
I'm fine.
probably set that up. All right, well, thank you, everyone. If we could get a group picture.
Sure.
Thank you.